Greetings. In this video, we are going to see about the bacterium Porphyromonas gingivalis. General characteristics of Porphyromonas gingivalis. Porphyromonas gingivalis is a gram-negative rod-shaped bacilli. They are non-motile in nature. The size of Porphyromonas gingivalis ranges from 0.3 to 3 micrometer in diameter. They belong to family Porphyromonaceae. Capsules are present which are made of polysaccharides. Endospores are absent. Porphyromonas gingivalis are obligate anaerobes. It requires optimum temperature of 37 degrees Celsius and optimum pH of 6.5 to 7 for growth. It lives in oral cavity, deep crypts of the tongue and in subgingival dental plate. It was first discovered by H. Werner in 1950s from an undocumented human oral infection. Disease transmission of Porphyromonas gingivalis. Porphyromonas gingivalis is mainly spread from person to person by salivary droplets. Here, saliva is considered as an important vector for transmission. Virulence factors. The ability of the microbes to cause an infection or disease is called as virulence. The term virulence was first discovered by Louis Pasteur. Virulence factors are the factors which are responsible for causing an infection in humans. Virulence factors of Porphyromonas gingivalis include fimbriae, polysaccharide capsule, hemolysin, hemagglutinin, outer membrane vesicles, lipopolysaccharides, gingipains, collagenase, protease, and superoxide dismutase. The incubation period of Porphyromonas gingivalis is about 3 to 7 days. Pathogenesis of Porphyromonas gingivalis. Step 1. Porphyromonas gingivalis first enter the oral cavity and then localize at and attach to the available surfaces. Step 2. Proteolytic enzymes secreted by Porphyromonas gingivalis degrade the adhesion molecules between tissue cells and the extracellular matrix. This weakens the structural integrity of the mucosa and allows the bacteria to penetrate the tissue. Step 3. Through the process of transcytosis, bacteria actively enter tissue cells and transfer to the next layer or extracellular space. By traveling from cell to cell, Porphyromonas gingivalis reaches deeper structures. Step 4. The bacterial cells then adhere to the mineralized hard tissues of the teeth along with mucosal surfaces including those of the gingiva, cheek and tongue. Step 5. Porphyromonas gingivalis can adhere to many of early plaque organisms forming biofilm that favor colonization, promote nutritional interrelationships and intercellular signaling mechanisms. Finally, bacterial progression causes periodontitis, gingivitis and atherosclerosis. Clinical diseases caused by the bacterium Porphyromonas gingivalis include periodontitis, gingivitis and atherosclerosis. Periodontitis. Periodontitis is one of the most common ailments affecting the teeth, leading to the destruction of the supporting and surrounding tooth structure. The term periodontitis is a build-up of two words, that is periodont, which means structure surrounding the teeth, and it is which means inflammation. Periodontitis is originally a disease originating from the gingival tissue, which, if left untreated, results in the penetration of inflammation to the deeper tissues, altering the bone homeostasis, causing tooth loss. Gingivitis. Periodontitis starts as gingivitis. While some cases of gingivitis never progress to periodontitis, periodontitis is always preceded by gingivitis. Gingivitis is a non-destructive disease that causes inflammation of the gingiva. Patients with gingivitis can also experience intermittent bacteremia. Atherosclerosis. Atherosclerosis is one of the most common types of cardiovascular disease, has initially been attributed to the accumulation of fat and fibrous materials. Periodontitis is related to the risk of atherosclerosis. Porphyromonas gingivalis can induce the dysfunction of endothelium, promote the formation of foam cells as well as the proliferation of vascular smooth muscle cells and lead to the imbalance of regulatory T cells and T helper cells, ultimately promoting the occurrence and development of atherosclerosis. Laboratory diagnosis of Porphyromonas gingivalis. Microscopic examination. In gram staining, Porphyromonas gingivalis shows pink-colored rod-shaped colonies. In negative capsule staining, unstained capsules are observed in stained background. In motility test, Porphyromonas gingivalis are observed to be non-motile in nature. Colony morphology of Porphyromonas gingivalis in blood agar shows black-colored colonies with beta hemolysis after about 7 days of incubation under anaerobic condition. In McConkey agar, white-colored non-lactose fermenting colonies were observed. The selective medium for the growth of Porphyromonas gingivalis is ginge agar. This picture shows the colony morphology of Porphyromonas gingivalis in blood agar forming black-colored colonies which act as major feature in identification. Laboratory diagnosis. Biochemical tests. Porphyromonas gingivalis is catalase test positive, oxidase test positive, urease test negative, indole test positive, methyl red test positive, Voges-Prosker test negative, citric utilization test negative, NTSI test H2S production was observed, thioglycolate test positive. Antibiotic therapy. Amoxicillin, clindamycin, doxycycline, minocycline and tetracycline are some of the antibiotics used to treat Porphyromonas gingivalis caused infections. Vaccination and preventive measures. A conjugate vaccine incorporating capsular polysaccharide antigen is effective in reducing the main clinical endpoint of periodontal disease. Most infections can be controlled by good oral hygiene practices and regular dental visits. An addition of honey or its compounds to oral healthcare products may have potential in prevention and treatment of periodontitis.